now I would like to, my session is AI hands-on AI. Still I am unable to memorize the topic which is given to me. So practically how it is applicable, I would like to share one of the success story of an organization which is known as Janitri. So this Janitri has got the remote patient monitoring devices. Especially they have created for remote monitoring of the mothers. How they have done is, one of their product is KR Echo. This is a smart handheld fetal Doppler. So the mothers will be able to monitor the fetal heart rate, and the data will be transmitted to the healthcare provider, and they can take the advice, and they will be taught how to identify the deviations and when to seek emergency care, and how to promote fetal health. So this is available for the mothers. And another one is home NST, non-stress test, how the fetal heart rate increases in response to the fetal movement is measured in non-stress test. It is required for high-risk mothers, especially where the fetal health might be compromised. So usually patients come to the hospital and they lie down for 20 minutes, and if the baby is not moving, there will be an extended NST for another 20 minutes. Then also, if the baby is not moving, then the vibroacoustic stimulation test will be done, and they'll see whether the fetus is moving. Even then fetus is not moving, then the mother will be sent for biophysical profile, where with the help of ultrasound, the fetal placental maturity, fetal breathing movements, fetal movement, fetal heart rate will be assessed, and they will decide whether any cesarean section is required or not. But for this, the mother has to come and spend at least half a day in the hospital. Now they have developed a device at the comfort of their houses. They can record, and the data can be transferred to the hospital, and they can be guided accordingly for immediate care is required or not. Similarly, they also have developed an app for smart pregnancy monitoring app, where they can track the baby kicks, daily fetal movement count. I still remember when we used to give the thread, and whenever the mother feels the fetal movement, they have to put a knot, and they have to bring that knot, and daily, at least after lunch, after breakfast, after lunch, after dinner, 1 hour they have to monitor. Minimum 3 knots should be there. This is how we have taught. And but though the mothers might experience an abnormality, they could not contact the healthcare provider. But here, digitally, the baby kick monitoring app helps them to monitor the kicks, and the data is transmitted to the healthcare provider. And you must be wondering whether healthcare provider will be all the time looking at this data. There will be pop-ups and alarms. Only if there is a deviation, alarms will come, and the healthcare professionals have to look into it, what is wrong with the mother, and provide appropriate advice. So this company has done a fabulous job, and it is available for the use of mothers. And now you must be having a question in your mind: if they have done for the mothers, what about for the hospitals? Because as healthcare providers, we also require the support of digital technology and the support of artificial intelligence to help us. So how it is applied? So if you see, they have created a digital labor monitoring tool. So this is a complete labor monitoring tool which includes WHO approved digital partograph, that is the WHO labor care guide, and postpartum monitoring protocols. So this monitors the patient's parameters, and the pop-ups and alerts will come, and for the nurses it is very easy to monitor them. And especially in remote areas, it is going to be very, very helpful, because they can transmit the data to their tertiary care hospital seeking the advice if required. Similarly, they have created another device called portable. There is a portable and precise fetal ECG. Fetal ECG, I don't know how many of you have heard. They have created an equipment which can monitor the fetal ECG and uterine EMG. And based on the fetal maternal heart rate, the uterine contraction monitoring also can be done. So this is a portable and precise device which can be used by the nurses and doctors in the hospital. So this generates the data, and the alerts are being given, and huge data will be generated, and this data will be helpful for artificial intelligence to come out the patterns, behaviors. That is how the WHO labor care guide also has emerged, because now they say that earlier, part of the modified photograph, it was 1 centimeter cervical dilatation for 1 hour was the expectation. So if the progress is not happening accordingly, the cesarean section is done. But now they say that we have to allow the mother to progress on their own pace, and they say that 1.5 centimeter per hour of cervical dilatation is also acceptable. So this kind of findings can come if you have the digital data and you can analyze the data, examine the data, and come out with patterns of behavior, how the patients behave, how the disease patterns emerge, so that we will be able to design interventions accordingly. And they also have got automated calculations for labor scores. Like we use a lot of classifications, Robson's classification, Bishop score for induction of labor, Apgar score of the newborn. All these also could be digitally generated and can be used. And digital case sheet generation, all patient related data will be on a digital case sheet. Once the moment you enter the data, there will be a digital case sheet generation, and this will be integrated up to discharge summary. I've seen hospitals where they keep on entering the data, treatment data, discharge summary is automatically getting prepared by the system. The doctors have to only see whether the proper information is given and any alterations are required. So discharge summary and the billing happens automatically whenever the care happens. This is how the artificial intelligence is helping. I can also say one more example for medication adherence or medication administration variation done by the nurses. Every nurse is given minimum 5 patients. If BD medication has to be given at 8 a.m. and 8 p.m., she cannot administer to every patient at 8 a.m. So a variation of half an hour before, half an hour later is permissible. But if she is administering the medication beyond this 1 hour time window which is given, then automatically the system will capture it as a medication error, and it will show as part of variation management that the medication is not administered on time. So this is how every behavior of us will be converted into data, and that data will be used for variation, and they will arrive at a mean value. And if we are deviating from the mean value, then it will be counted as variation, and the pop-ups will come and variation management tools will be generated. This is how it is going to impact nursing in future. So they also have this, Janitri also has developed nurses application. So this generates live FHR, MHR, and uterine contraction graphs to get instant updates on the health of the patient. And it will send important notifications to avoid any complications. So this can be used as a monitoring tool and prevention of complications. And remote access to patient data. The patient can be in the room and the nurses will be able to access the data in the nurses station, or if the home monitoring tools are there, even after they are discharged, they will be able to monitor. So now we are on now doing a project to help using the AI application for guiding the breastfeeding practices of mothers. Just the project got approved. So once we collect the data and findings are ready, we will share it publicly. And now here I would like to share some of the practical experiences, how we have done it. Like one of my MSc nursing student last year, she did a study, a prospective observational study to assess the sleep stages in unconscious patients with acute severe traumatic brain injury monitored by actigraphy smartwatch at neurosurgery ICU of AIIMS New Delhi. So how she has done was, we used a smartwatch which was placed on the hands of the unconscious patients who were suffering from TBI, traumatic brain injury. So this is how to use the wearable device and the data generated from wearable device to arrive at nursing care plans. So usually when the patients are unconscious, we think that they are sleeping. They may be sedated if they are on ventilator. We do not know whether they are sleeping, whether they are really unconscious or not. So this study was very, very helpful using the actigraphy technology. The smartwatch was picking up the REM and NREM sleep cycles, and we found that the how much time the unconscious patients are sleeping actually. Though they are unconscious, they are not actually sleeping. They are awake. They also have got the same sleep cycles like us. So that is what is being predicted by this smartwatch, because it was predicting the heart rate and how during REM and REM sleep, how our heart rate will be. I do not know exactly what technology the smartwatch has used, but it was able to pick up even the sleep cycles of unconscious patients. So such wearable technologies are very, very helpful for us. So this is one of the example I would like to quote here.